There was once a time when no one had heard of Marina. But now it has become a part of everyday medical language, since the Crown 19 Vortex became available. But I wanted to know the answers to the questions: what is Marina, and where did it come from? I did not realize how difficult it would be to understand what has been written, so I will share as best I can what I found, with a lot of sources and references, for you to explore for yourself. Marina is known as messenger Marina, and it is a molecule that contain instructions or recipes that direct the cells in the body to make a protein, using their natural machinery. Lipid nanoparticles are used for the Marina, which acts like a protective bubble to penetrate the cells to deliver instructions and build proteins that match up with parts of the pathogen called antigens. The body recognizes these antigens as foreign invaders and release antibodies and T cells, which will train the immune system for future invaders. The goal of the Marina is for the body to recognize when a real virus comes along so that it can defend against it. This sounds ridiculous to me, when the human body has a system where it has the ability to fight off infections and viruses naturally, with no intervention. I would speculate that if someone was consuming a lot of food and drink that contained several different chemicals, then their body would have a harder time fighting off infections or viruses, because it was already dealing with the current intake. This Marina technology is another way of removing natural healing processes, and for the encroachment of scientific technological innovation in our lives. According to the Johns Hopkins Bloomberg School of Public Health, the origins of Marina technology date back to the early 1960s and then to the 1970s. Chris Bayer stated in his article, The Long History of Marina Vortex, published in October 2021, that research began, on how Marina could be delivered into cells, I find it rather conspicuous that ideas for Marina technology were sprouting at the same time as the use of LSD and the CIAMK Ultra Mind Control program, but I digress. Not only that, but to discover that Marina has been hiding throughout all this time, and only really showed itself until the Crown 19 pandemic shocked me. Although the Crown 19 Vortex was not the first Marina technology to have been created, as the first Marina flu Vortex was created in the 1990s, it was tested in mice, but human Marina Vortex were tested in humans by 2013. Researchers were having problems trying to get the body to deliver the RNA transcript, in other words, the message, so it would be able to read into proteins in the cells, but it was being degraded before it could do that. But when the advancement in nanotechnology happened, they were able to create lipid nanoparticles, which are like, fatty droplets, that can penetrate the cell better and translate the Marina into proteins of a virus so that the immune system can, recognize the foreign protein, The first Marina Vortex was created for rabies, and tested in humans in 2013. The first Marina Vortex to use lipid nanotechnology was for Ebola. However, because that virus is only found in a small number of countries in Africa, it wasn't considered for commercial use in America. The FDA approved this Vortex on December 19, 2019. The Vortex was named Ervbo, and was supported by a study that was conducted in, Guinea during the 2014-16 outbreak in individuals 18 years of age and older, The approval was granted to Merck & Company. Although the general public was not familiar with the term Crown virus, until the recent pandemic, there were other versions of respiratory diseases, found in the region of the Middle East, back in 2012, that were termed MERS-CoV. The spike glycoprotein is a determinant of host range and is a target of neutralizing antibodies and subunit vortex development, Not only do Crown viruses infect humans, but they also infect other mammals. Crown viruses have the, largest genomes among known rhinoviruses, The first 4 crown viruses listed below are more severe in human infants, the elderly, and the immunocompromised. If animals are infected with crown viruses, they can evolve, make people sick, and become a new human crown virus. 3 examples of this are the 2019 nCoV, the SARS-CoV, and the MERS-CoV. Both MERS-CoV and SARS-CoV emerged into the human population, quote, from animal reservoirs in the last 15 years and caused outbreaks with high case fatality rates, unquote. MERS-CoV was isolated from a patient in Saudi Arabia in 2012. This virus is still in circulation around the Arabian Peninsula. I'm no expert, virologist, or scientist, so I am unable to convey anything about these viruses or the treatments deemed suitable for them. This is something you will have to look into yourself. There has been an ongoing debate on whether the Marina Vortex that were used to combat Crown 19 are in fact gene therapy. However, experts told Reuters Fact Check that, quote, Vortex that use Marina technology are not gene therapy because they do not alter your genes, unquote. Dr. Adam Taylor, a virologist and researcher at the Menzies Health Institute, Queensland, Griffith University, said that Marina is genetic material, so it could be looked at as gene therapy, but because they are classified as Vortex, they are not designed to alter genes. He said that gene therapy involves making changes to someone's DNA so they can be treated. He also assured that the Marina Vortex would not enter a cell's nucleus, where the DNA genome resides. The FDA states that gene therapy is used in a variety of diseases, like cancer, genetic diseases, and infectious diseases, to, quote, modify or manipulate the expression of a gene or to alter the biological properties of living cells for therapeutic use, unquote, like curing diseases or inactivating diseases, as well as, quote, introducing a new or modified gene into the body, unquote. You can pause the video to read this, or you can find it on the website at afflictedmediablog.wordpress.com, under the blog post Where Did Marina Technology Come From? The organization that is responsible for the regulation of biological products and gene therapy is the FDA's Center for Biologics Evaluation and Research. According to their website, quote, clinical studies in humans require the submission of an investigational new drug application prior to initiating clinical studies in the United States, unquote. I am sure the Crown 19 Vortex are still under authorized emergency approval and are still not properly approved, and we are in the middle of 2023 now. Since December 6, 2020, which was nearly a year into the pandemic, the UK government decided that if anyone was hurt or injured because of a Viper Crown 19 Vortex, then Viper would be granted legal indemnity, which protects them from any civil lawsuit. This means that victims who were injured by the Viper Vortex will not be able to seek justice in that manner. There will be no imprisonment for anyone involved in it. However, there is a compensation payout of £120,000 for individuals who have been highly damaged. The UK government statement said, quote, the new regulation, Regulation 345 of the Human Medicines Regulations of 2012, prohibits civil liability against Viper or healthcare professionals distributing the Vortex for any damage that arises through use of the Vortex in accordance with its recommended use, unquote. I don't believe this is fair at all, considering there was no informed consent and this Vortex was coerced on every human around the planet. This is an atrocity and adds to the pile of crimes against humanity.